vaccine.
Welcome back. According to a recent poll by the Washington Post Kaiser Family Foundation, about 3 in 10 healthcare professionals in the United States say that they've considered leaving the profession due to burnout and stress since the pandemic started last year. How can healthcare professionals seek help during these difficult times? To learn more, let's go to Saliha Farouk as she speaks to Sahar Durrani. Over to you, Saliha.
Much appreciated, Henna. Today we're joined by Dr. Sahar Durrani, who is a graduate of the Wright Institute's APA-accredited Doctor of Psychology program, working with college students at UC Berkeley in new primary healthcare integrated program. Dr. Sahar joins us today as a psychologist from the University of California, Berkeley. Thank you so much for being here with us today, Dr. Sahar.
Thank you so much for having me.
Our pleasure. So I just first wanted to talk about this phenomenon of burnout, which is, of course, something that is experienced across numerous professional fields. But what kind of burnouts since March of last year are causing medical professionals to deal with this new phenomenon in the healthcare industry?
It has been wild, I would say. A lot of the medical students and students that have been out of school for a while, whether they're in training or recently graduated, or if they've been practicing as a physician or, nurse practitioner or healthcare provider for decades, all seem to share this experience that they have never experienced so much loss and death in their workplace. And they train so that they can work really hard to save lives. And while it's inevitable that they will see some loss of life, the number has been at a magnitude that has never been really seen before in our generation. So it is impacting a lot of healthcare workers, whether it's the person that checks you in at the beginning or the physician that's going to be treating you. There's a lot of chaos that is occurring that inevitably is going to flare up some anxiety for people that are providing services.
So most of us can only imagine the experiences that doctors are going through, as you described, during a time when hospitals are mostly have reached their capacity with COVID-19 cases. If you could talk to us a little bit more about the kind of challenges that healthcare professionals are dealing with today, and how that might differ to perhaps before March of 2020 last year.
Sure. I think during last year rather, there was so much uncertainty about how we were going to be impacted by the pandemic. So as of last year, we have realized the lack of protective gear, PPE, that we've had in so many hospitals across the country. We've noticed the lack of mental health care professionals that are going to be needed that are in demand because of the anxiety and depression and health anxiety that COVID-19 has brought on in the community. There's been a lot of folks that are anxious to go to work because they are nervous to get sick. They are nervous to get their family members sick, especially if their family members have a compromised immune system. There's also a lot of people who are feeling anxiety about everyday activities, like starting to go back to the grocery store. So there's sort of been, in the last year, this view of how we've been impacted and how we were very unprepared as a nation. And even at our local hospitals that we believe are very well funded, but well funded doesn't always mean well resourced. And also, we have seen I have seen in the mental health perspective, anxiety people are having about re-entering the community, going to the grocery store, returning to school or work. So there's a whole host of issues, mental health and health issues that we're seeing now since it started last March.
And when it comes to these various effects and impacts upon medical professionals, if you can just talk to us about the meaning of burnout here. And for example, when it comes to different symptoms like emotional exhaustion and depersonalization and stress and anxiety in the way that you mentioned, how is this made worse specifically during this pandemic?
Sure. There has been, the stay-at-home orders, there's been such an intense push to prioritize sheltering in place and not being around one another so that we can keep each other healthy and safe. And in doing so, inevitably, there has been isolation, and often I find isolation breeds depression. So there has been difficult because we want to stay healthy and we want to stay away from our family members and our friends because we want to protect each other from getting COVID-19. However, the underbelly, the dark side of that is that we're not around people, we're not seeing people as much, and we might feel lonely, and that can often breed some isolation and need for reaching out to other people. So not having physical contact, whether it's through school or work, can really negatively impact the human psychology.
Course. And just going back to the kind of work that you do in your profession, approximately 17% of all physicians in the United States are actually from Asian ethnic backgrounds, as well as racialized and Black backgrounds as well. So with different cultures having, of course, different attitudes to practicing medicine and personal and academic achievement, how does the idea of burnout affect racialized doctors differently?
This is a very timely question, actually. We are coming up the year anniversary of the George Floyd death and a lot of Black Lives Matter movements and a lot of social justice movements all around the world. And I believe for people of color, it has been an incredibly difficult time to exist just in general at baseline. And on top of that, our clinicians, our providers, mental health and medical providers of color have had a much more difficult, I imagine there's going to be a much more difficult time in terms of adapting to the sense of loss. There's always going to be research that's going to show how people of color might be impacted more or overworked more or not receive as many resources. And so that's something that we shouldn't ignore when we're thinking of our doctors and nurses and healthcare providers in the hospitals. Are they having time in between their days and weeks to go to see a therapist or see their own doctor? Do they have time to actually rest on their time off, or are they really just recovering from the burnout? There are higher rates of burnout and anxiety and stress among clinicians of color because of things like systemic oppression and feeling as though they have to perhaps work harder than some of their peers, whether it's socialization or to get the same accolades or salary. And so there's a notion that people of color and especially clinicians of color in the healthcare industry are going to feel more burden in different ways that their, white counterparts might not.
Very interesting. And going back to the kind of research and the kind of work that you do with different clinicians, as you were saying, how does the current situation with healthcare providers being now impacted so much more versus last year? How is that changing the work that you do? What are the new trends or the new lenses that academics are using to be able to understand the experiences of doctors and physicians and to be able to perhaps maybe propose solutions or policy level change to be able to help this very significant sector of all of North American society?
Thank you for asking that. There's certain rules that are being sort of a little bit more flexible around. So when I think of mental health, for example, in my particular field, practicing counseling across state lines, that's something that we're not able to do because of our license. However, if people were displaced or had to move or something came up during the pandemic, the Board of Psychology has been okay with us going ahead and being a little bit more relaxed around practice policies. And the intention there is so that nobody goes without mental health services because of possibly having to move back home because they lost their job or something like this. I've also noticed that many insurance companies have waived a copay for mental health fees. So a lot of my clients, especially, whether it's at UC Berkeley or in a private practice setting they're paying with insurance, have been able to have, zero copay. It's one less thing that they need to worry about while the pandemic has been happening. And there's also access to many, many drive-through testing sites. I find that depending on the area, but most major counties are going to have lots of resources, especially now that it's been about a year out in terms of drive-through COVID testing and getting vaccinated.
Okay, thank you so much for touching upon the different resources that are available. If you could, which leads me to my next question, just to counter these various psychological and social effects that are targeting healthcare professionals at this time, are there sufficient number of systems in place, systems of support that can help physicians and navigate these challenges? Do you feel like from your perspective, there could be more at this time?
I appreciate that question. One of the One of the things that's important to note in the Washington Kaiser article that talks about healthcare workers experiencing burnout, there's a mention in research data showing that about 3 out of 10 healthcare providers would consider leaving the medical field after experiencing working in that field during the COVID-19 pandemic. So about 3 out of 10 are so incredibly burnt out and so incredibly anxious and maybe tired that they would consider finding a different line of work. Now, one of the things that I think will be a barrier to getting services to our healthcare providers, there's almost this idea of not having enough time, feeling as though one has to work nonstop or pick up extra shifts, take on more clients because there's this overwhelm and this need. And oftentimes people in the healthcare industry are going to be coming from a place of wanting to be more of a giver and often go out of their way to try to help others, even if it's at the exclusion of their well-being. And while there are lots of therapy and counseling and other resources available, especially for healthcare providers, medical providers, there is still a stigma that I believe exists amongst medical providers being able to freely and openly go out and seek counseling, let's say. So I believe one thing that we could do, and one thing I'd be interested in doing, is coming up with programs, training programs and clinical therapy programs where we can provide counseling specifically to frontline healthcare workers. And, having worked at UC Berkeley where there's physicians working alongside psychologists, it's a very, very beautiful, nuanced way to be able to have both approaches, the medical skilled background and also the mental health person who can help talk through the process as there's a lot of chaos and as the medical setting has become a lot more intense over the last year. So I think hopefully destigmatizing, being able to seek out mental health services in general for the community, but also for those that we deem as strong pillars of our society, like the healthcare providers who are on the front lines doing the hard work, hands-on.
I really appreciate you going into what could be done, more resources that could be put into place for these frontline workers. Your work is mostly based out of Berkeley, California. From that light, if you could talk to us about what systems currently are in place that people can turn to in this field, if they are dealing with whether it's burnout or different kinds of anxieties or stresses from really dealing with this global pandemic, who could they turn to, where could they turn to, depending on where they are in America or across North America?
Absolutely. I find most people will turn to the internet as a great way to reach resources. So if one was my go-to, what I share with my therapy clients is if you were to Google or search counseling near me or sliding scale therapy and then put in a zip code, this will bring up any of the counseling and low fee options. So anything sort of like low fee counseling or sliding scale counseling, or any of these words that are interchangeable to find some sort of resources around your zip code that are going to be either low fee or a hotline. Every county, and there is a national hotline, tends to have some sort of suicide hotline or mental health hotline. My experience is that one does not need to feel necessarily suicidal to call these mental health hotlines. They're really there as a safeguard to help talk people through moments of difficulty. And so I would seek out those resources. For folks that do have insurance, you could go ahead and look at your insurance card and call the number on the back under member services. You'll be able to get mental health benefits, find out how much your sessions would cost, and then get a list of providers covered under your insurance plan.
Wonderful. Thank you so much, Dr. Sahar Durrani, for talking to us today about physicians on the front line and dealing with COVID-19. Really nice to have you.
Thank you so much for your time. I appreciate it.
Our pleasure.